Who out there enjoys the sun? Well, close your eyes right now and just imagine yourself at the beach. It's a perfect day, 80-degree weather, feet in the sand, cold drink in your hand, and you're soaking up the sun, getting that golden tan that you've wanted all year. I know that I would want that. But just think for a second. What if I mentioned the term skin cancer? How does this make you feel? Does it make you want to go slab on some more sunscreen? Or do you feel distant and nonchalant to this meaning? Regardless, for some of us, it goes deeper than that. It has affected our friends and families of all ages and is becoming more and more common. Now, the sun is our ultimate source of life, but as the saying goes, too much of something is really not that good for you. I'm here today to educate you all on skin cancer and the way to prevent. Let me start off by defining skin cancer. This is when malignant skin cells accumulate on the skin surface. Now you may ask, well, how does this happen? Well, according to Relay Clinical Education, when we are exposed to too much UV radiation from the sun or from tanning beds, we are causing our skin's immunity to deplete. You can think of immunity as placing armor on yourself. What does armor do? Armor protects you from harm, and that is what your immune system does for you. It protects you and gives you the ability to fight off common colds and cancers as skin cancer. So when this depletion happens, 3 common skin cancers occur. The first type is basal. Now, basal skin cancer is the most common, affecting about 90% of all the cases in the US. Now, basal skin cancer is the least deadliest because it doesn't spread. Basal skin cancer usually just occurs on the outer skin layer, which makes it easy for doctors to remove and to be cancer-free. Though it is easily removable, basal skin cancer usually will reoccur in 3 to 5 years after it first occurred. So that is a key to look out for. The second type of skin cancer is squamous skin cancer. Now, squamous skin cancer is very similar to basal skin cancer. The only real difference is that it is found in the deeper tissues of your skin. So when it comes time to the doctors removing it, it's a little more invasive because they have to go deeper into the skin to remove it. Now, the third type is melanoma. Melanoma is found in about 5% of cases, and out of the 3.5 million cases of skin cancer, about 760,000 are of melanoma. With all of this said, though, there is hope, and that is through preventative measures. The first type of preventative that I would like to discuss is sunscreen. Now, sunscreen is vital to protect your skin from harmful UV rays, but you must use at least a 15 SPF. Now, let me talk a little bit about SPF. SPF is sun protection factor. This allows you to know how much protection you are getting from your sunscreen. Now, a little rule of thumb when you want to determine your skin sensitivity, if you go outside for 10 minutes and you begin to burn, you can actually multiply that 10 times the 15 SPF and you'll get 150. That 150 allows you to know that you can be outside for 150 minutes until you would have to reapply the sunscreen. So for instance, I have this Hawaiian tropic and it says SPF 8 on it though. SPF 8 is proven not to protect me from all the harmful UV rays. So this is actually not a good example in which you should use. I would also now like to talk about vitamins. Vitamins are vital for fighting off skin cancer. Earlier I discussed how your skin immunity begins to deplete. So vitamins begin to restore the depletion that occurs in your body. So when you are putting the nutrition into your body, it is making you stronger and able to combat any kind of sickness that is going on in your body. Now, a few examples of some great vitamins is vitamin A, vitamin C, vitamin E, and vitamin D. These will all be sure to strengthen your immune system, enabling you just to combat cancer. I now would like to talk about preventatives and knowing your skin. It is important to know the difference between a healthy mole and freckle from a mole and freckle that could turn cancerous. Now, I want to clarify that moles are normal. You can get moles from childhood all the way up until you're 102 years old. They come and go, but moles should never change color from a brown. They should never turn a blackish or a clear color. They should never bleed or become itchy. Now, moles that bleed and become itchy, you need to go see a doctor immediately. These are not normal symptoms that a mole should have. Other than a mole, skin cancer can show up in a lesion. A lesion is a small flat surface that can occur on your face, your neck, the back of your ear, the top of your head, the top of your hands. And this is obviously because you're getting the most exposure throughout the entire year of UV rays. So when this happens, it is very important to determine that you need to go see a doctor, and it doesn't matter how much that doctor bill will be, how far away the doctor is. Nothing is worth more than your life and your health. And you must do that for yourself and do it for your loved ones. So I wanted to show you a couple examples of a mole this is actually a melanoma skin cancer. As you can see, this is in a large view, but it is a flat. This would be more of a lesion. Actually, this would not be more of a lesion. This is more of a mole that's just flat, because moles can be flat. But you can see that there is darker areas, lighter areas, clear areas, and in my lifetime, I have never seen a mole, I have plenty of them myself, look like this. So this is important to, if you ever see a loved one have something similar to this, just to motivate them to go see a doctor. Now my second example is, this is a basal cell skin cancer. I discussed this earlier. This is the most common type of skin cancer. As you can see, this is enlarged also. And this type is actually more looking like a pimple. It has places of pink and then clear, and then there's a little example to show you of what a basal cell cancer would look like. So as Dr. David Leffel, a professor of dermatology and surgery at Yale Medicine, says, when in doubt, just check it out. Though skin cancer has become an epidemic, we must understand that we have to take charge. We have so many preventatives as the sunscreen, as vitamins, and doing routine mole and skin checks. We do not have to be victims of skin cancer. With knowledge is power. Power for our lives and loved ones. Thank you.